Hello and welcome to the first lecture on digestive diseases. We're going to cover the bacterial diseases today, but first I want to share something with you from my uh, Bible time this morning. This is John 8, verses 31 through 36. Jesus answered and said to the Jews who had believed in him, "If you continue in my word, you are truly my disciples, and you will know the truth, and the truth will make you free." Verse 34, Jesus answered them, "Truly, truly, I say to you, everyone who commits a sin is a slave to sin. The slave does not continue in the house forever. The Son continues forever. So if the Son makes you free, then you are free indeed." Let's keep that in mind as we go about in our quarantine, that we're not confined. We are free. We are free in Jesus. So hang in there. So let's talk about bacterial diseases in the digestive system. All right. So why is the digestive system an important portal of entry for microorganisms? As you think about this, let's review the anatomy of the digestive system. So remember, it's divided into the GI tract, which is the mouth to the anus, okay? And then we have accessory digestive organs. If we look at the GI, remember it digests food, absorbs nutrients and waters into the blood, and then eliminates the waste. We have the mouth, esophagus, stomach, small intestine, large intestine, the rectum, and the anus. And here we have our lovely picture. And so what are we looking at here? What are the portals of entry? So the portals of entry are going to be the mouth, and sometimes the anus, but this is what we call the fecal oral route. In other words, someone goes poop in your water and your water gets contaminated, or they don't wash their hands and they contaminate your food. You either drink the contaminated water or eat the contaminated food, and then you get infected. Remember the accessory digestive organs: tongue, teeth, salivary glands, liver, gallbladder, and pancreas. Mainly where we see bacterial disease is going to be in the tongue, the teeth, around the mouth, and then viral diseases we see more in the liver than anywhere else. So let's first look at the structure of the teeth. And remember that we have normal microbiota that grow in our mouth. And without proper dental hygiene, these can form biofilms, and then these biofilms can break down the enamel through the dentin and into the pulp, and they can infect the gingiva, the gum, and cause gingivitis, which is inflammation of the gums. So when we look at the esophagus, the stomach, and the duodenum, these are mainly free of microbes. They're there to, break down macromolecules into monomers, and then peristalsis transport. The teeth, the tongue, the jejunum, ileum, colon, and rectum all have microbiota. Viridians, streptococci are the most prevalent in these regions. And these microbiota are going to mainly function as antagonists. In other words, they keep other bacteria from infecting and causing disease. So why does use of antibiotic drugs or antibacterial drugs over an extended period of time increase the likelihood of oral candidiasis, sorry, I butchered that, thrush, and C. diff diarrhea? You stop and think about that. Basically, this means that the antagonist microbiota have been killed off, and so Candida, which is a fungus, and C. diff, Clostridium, then can overgrow and cause problems. So let's look very quickly at dental caries, gingivitis, and periodontal disease. Caries is cavities. So these are holes or pits in the teeth. Periodontal disease means disease of everything but the tooth. And this is when the gums are swollen, they're tender, bright red, or they bleed. So the virulence factors and the pathogen, we're looking at Streptococcus mutans is a frequent cause of cavities. And because of its sugar coating, dextran and fimbriae, they adhere to each other, a biofilm forms, and this allows the bacteria to stick into place and start breaking down the enamel. Okay? P. gingivalis causes periodontal disease. It produces a protease that breaks down the gums. So here you just see some pictures that show you the beginning of plaque formation, the biofilm. Notice that a lot of times this is more in between the teeth than on top. And then as they produce their enzymes that break down the enamel, then we have caries or cavities forming. They can break into the pulp, and this is very, very painful. So how do we prevent this? Brush your teeth. And what else? Floss. That's right. Brush your teeth and floss. That's it. Okay. Try to avoid sugary treats. Sucrose, more so than fructose. So where are you going to go to get treatment? Your dentist. Hooray for dentists. Okay, good. You need to go to the dentist and get your teeth cleaned every 6 months. It's important. It's important. Okay, down to the stomach. Peptic ulcers. And then this can also go into duodenal ulcers. But you have severe abdominal pain, usually around your belly button. This is caused by the bacteria Helicobacter pylori, and up until about 25-30 years ago, everybody thought it was just stress. You're stressing out, producing too much HCl, and burning holes into your stomach. Well, stress does affect this, but a physician in Australia figured out it was this bacteria, Helicobacter pylori. It has several virulence factors. It's able to swim, it can burrow, it adheres, and then it has an enzyme called urase that neutralizes the stomach acid. So here you see the bacteria, which is usually taken in by contaminated food or water. The bacteria invade the mucus. They can neutralize the stomach acid, invade the mucus, and attach to the gastric epithelial cells. Here, using toxins, and this causes inflammation. That causes the mucus or the mucosa to become thin. The acidic gastric juice and the bacteria will destroy the epithelial cells in the underlying tissue, and that can allow bleeding into the stomach. Someone has a bleeding ulcer. This oftentimes will be manifested by vomiting blood. If they vomit up bright red blood, they've hit an artery and they are in serious danger. If it's rust-colored, kind of coffee ground, and it's older blood, it's usually venous blood. So, like I said, this is fecal oral. Stress can worsen because when we're stressed out, we produce a lot more HCl. We diagnose with X-ray and presence of Helicobacter pylori in the vomitus. We can treat with antibiotics and drugs that inhibit stomach acid, like proton pump inhibitors. And how do you avoid fecal oral transmission? You make sure your food is clean, you make sure your hands are clean, and you make sure that your water is clean. Bacterial gastroenteritis. So gastro is stomach, enteritis is usually the intestines, and this is caused by bacteria. So inflammation of the stomach or the intestines caused by bacteria, and it is nearly always associated with contaminated food or water, and we find this mainly in areas with poor living conditions. In other words, they do not have clean water and they do not have proper sewage treatment. Basically what we see, nausea, vomiting, diarrhea, abdominal pain, and cramps. All right. If it's dysentery, then it produces a very loose stool, contains a lot of mucus, some blood, and they're pooping 10, 12 times a day. How do we treat this? Well, first of all, we have to replace fluid and electrolytes, and then sometimes, antidiarrheal medication works, and sometimes it just prolongs the problem. Sometimes we can use IV drugs and oral drugs. How do we prevent this? Wash your hands. Wash your hands. Handle, store, and prepare food properly. Properly. That means you cook your food. You don't eat raw fish. You don't eat raw hamburger. You don't eat raw meat. All right? So, what we look at is bacteria are going to proliferate between 41 degrees Fahrenheit. That's your refrigerator is at about 40 degrees Fahrenheit to about 135 degrees Fahrenheit. And not only the bacteria, but their toxins. Some of the toxins can resist heating, but a lot of them will break down. So if you're going to cook your food, notice here that fish, shellfish, lamb, beef, and pork needs to be at least 145 degrees Fahrenheit. That is medium well done. Cook ground beef at least to 155 degrees. Cook poultry and stuffed foods to at least 165, and you're going to reheat all leftovers to 165. Ground beef juices should run clear. All right? When you look at beef and pork and chicken, juices should run clear. There should be no blood. No blood. So make sure that you cook everything properly. Yeah, those who like rare steak, It's a no-no. So let's look at shigellosis. This is caused by Shigella, and the virulence factors are type 3 secretion systems and enterotoxins. The pathogen is going to colonize the cells of the small intestine and then the large intestine. And basically the way you diagnose this is to look for Shigella in stool samples. we have to do supportive treatment and antimicrobials. So the bacteria is going to attach to the epithelial cell. It'll trigger endocytosis, and when it's taken into the cytosol, it will begin to replicate. Then it will invade neighboring epithelial cells, and an abscess forms and the epithelial cells are killed, and the Shigella can continue to spread. If the Shigella enters the blood, it does so, it's quickly phagocytized by neutrophils, and so we don't find bacteria in the blood. Okay, should not be bacteria in the blood. It rarely ever happens. Traveler's diarrhea, also known as Montezuma's revenge. It's caused by E. coli, and the virulence factors are adhesins, fimbriae, and toxins. Diarrhea is mediated by the enterotoxins. It's very, very common in developing countries. Any place that doesn't have adequate treatment of their drinking water or their sewage. And so we're talking about any place where you can't get good clean water. We look at diagnosis on signs and symptoms, fluid and electrolyte replacement. A lot of times with traveler's diarrhea, if you take antidiarrheal drugs like Pepto-Bismol, etc., it will prolong the infection. You just gotta poop this out. Campylobacter diarrhea. All right, this is the most common diarrhea in the United States. It's caused by Campylobacter jejuni. Guess where it's found? In chickens in the duodenum. All right, adhesins, cytotoxins, and endotoxins. Are you starting to see a pattern? Adhesins and toxins. The virulence factors cause bleeding, lesions, and inflammation. And the chickens are the main source of our human. Diagnosed based on signs and symptoms. Most cases are, will self-resolve. What do? All right, you got to wash your chicken. I know some people say, don't wash your chicken. Yeah. Wash it. Use proper hygiene. Wash your hands. If you put raw chicken on your countertop, hey, wash it. Disinfect it. Okay? I cut all my raw poultry on a paper plate and throw the paper plate away. This is what Campylobacter looks like. See its happy little flagella? Okay, the most common cause of bacterial gastroenteritis in the United States. Next, we're talking about C. diff. Okay, this is caused by Clostridium difficile. What do we know about Clostridium? It requires an anaerobic environment, and what else? It forms spores. Okay, so usually what we see is that the toxins are going to cause inflammation in what's called the pseudomembrane formation. And what we see in severe cases is this pseudomembranous colitis. And this is very painful, and this is mainly what drives people to the doctor. Use of antimicrobial drugs will kill off the antagonists to C. difficile, and this facilitates the overgrowth of C. difficile. What are some of the things you need to do when you're taking antibiotics and you start getting diarrhea? Honestly, eat some kind of live culture yogurt, take probiotics, and this will help prevent overgrowth of C. difficile. Here's a picture of pseudomembranous colitis. And yeah, this is a really severe case. Those lesions are like pus pockets. And you can see that would make going poop very, very painful. Okay. When we look at this, it can be treated with antimicrobials, but sometimes that just exacerbates problems. This is why we don't need to overuse antimicrobials. And then there's a really cool experimental procedure called fecal transplants. And I encourage you to go to PBS, as public broadcasting, PBS, or you can just Google PBS fecal transplants. And it is a program that's about an hour long, but it's absolutely fascinating, and it's something we would watch in class if we were together. So I encourage you to Google that, to find it, and to watch it. It's quite fascinating. Not sure that's something I want to do, but hey, who knew? All right, let's take a break right here. Stretch. All right, stretch. Bacterial gastroenteritis with salmonellosis and typhoid fever. So Salmonella enteritica has serotypes. Some people want to call them strains. It's not quite correct. Serotypes. You have typhi and paratyphi that cause typhoid fever, and enteritis and typhimurium that cause salmonellosis. We do have vaccines for typhoid fever. And if you're going to travel someplace where typhoid fever is endemic, you need to get the vaccine. So the bacteria, salmonella, can tolerate the acidity of the stomach. It goes into the intestine. It produces toxins. And then these toxins are going to disrupt how your intestinal cells work. Typhoid fever is acquired by contaminated food or water, and salmonellosis is often acquired by consuming contaminated eggs. They're not properly cooked, and the toxins may not be destroyed by heating. I don't know about you, I wash all my eggs because they come out of a chicken's butt. And yeah, chickens got cloacae, and yeah, no, wash your egg. Okay, so the salmonella attaches to the epithelial cells in the small intestine. It gets endocytosed, it multiplies, and then it kills the host cell and invades other cells, as well as it can enter into the bloodstream. So in shigellosis, we don't see bacteremia, but in salmonellosis, we see bacteremia. That's one of the distinguishing characteristics. Okay, so what do? Well, you find salmonella in the stool. A lot of times it can be self-limiting. Typhoid fever can be treated with antimicrobial drugs, but how do you prevent this? Wash your hands, wash your eggs. Okay? Be careful what water you drink. Make sure people haven't pooped in the stream, upstream from where you're trying to get water. There are straws that you can buy that are filters. They're fantastic, and they filter out everything, absolutely everything. So if you're going to go hiking, if you're going to go visit third world countries, then you need one of these straws, or you need to make sure you have an adequate supply of bottled water. Cholera. This is caused by Vibrio cholerae, and we find these bacteria in salt water and fresh water. Usually what happens is people get exposed to this because they have eaten raw oysters or raw clams or oysters or clams that have not been properly cooked. What happens is that this bacteria is found in the poop. There are people who are carriers who are asymptomatic, and they poop out this bacteria. And if the sewage is not treated, but just dumped into some place, say like the Gulf of Mexico by Galveston, then the little filter feeders, known as oysters and clams, filter the poopy water, and the bacteria get stuck in the oyster, the clam. What other things eat poop? Shrimp, lobster. Yeah. Okay. So, not good. So the virulence factor really isn't the bacteria itself, but its toxin. It's called cholera toxin. We do have a vaccine against cholera. Okay. So the cholera toxin binds to the membrane of the epithelial cell in the intestine. All right. A portion of the toxin called A enters the cell, and it's going to activate adenylate cyclase. Adenylate cyclase then is going to form cyclic AMP from ATP. Cyclic AMP then is going to stimulate the cells to secrete chloride, sodium, and other electrolytes. Class, what always follows sodium? Water. What always follows sodium? Water. Usually chloride is passively transports with sodium, but water always follows sodium. So water follows the electrolytes into the lumen. You got too much water, then you got diarrhea. Not good. In the 90s, early 90s, and then again in middle 2010, 11, and 13, we saw epidemics of cholera, and you'll remember that in 2010, 2011, 2013, if you look at the islands, those islands were hit very, very hard by some nasty hurricanes, and they lost all their sewage treatment, and so poopy water was everywhere because of flooding. Poopy water was everywhere, and it got on everybody and in everybody's clothes, and cholera broke out. And it killed a lot of people. So pay attention. Pay attention. What do we do? Well, the diarrhea is called rice water stool because it looks like it has little pieces of rice in it. It's nasty, it stinks, it makes you gag, and what we can do is replace electrolytes, administer doxycycline, and since the vaccine is against the toxin, there's not lifelong immunity, so you have to get revaccinated. How do we prevent this? Do not put poopy water in clean water. Treat that sewage, okay? Wash your hands. Cook your food. Good grief. All right, here's table 23.1. And what we're seeing, these are the common forms of bacterial gastroenteritis. So I would put a little star by this table, and I would use it on the next exam. Here's the rest of it. Nasty, 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 nasty. Okay? So read through it. Read through it. Cholera, death can occur within 48 hours if untreated. It has up to a 50% mortality rate. Bad, 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 bad. Don't eat raw oysters. Cook everything. You see here, so much of this is fecally contaminated food or water. Fecally contaminated food or water. Do you see a pattern? Yes, you do. Okay. Last, we want to talk about intoxication. Mainly this comes from Staphylococcus aureus, and we touched on this when we talked about Staph aureus and skin disease. But the variance factors are 5 enterotoxins. Entero means intestine. Toxins are toxins. So usually we find this where there's been a gathering of people and food has not been properly iced down. People will have nausea, vomiting, diarrhea, and cramping. I mean, what's different from that? But we can see that basically if people wash their hands and people keep things that are creamy or have milk, cheese, keep these things on ice, keep them covered. Make sure that if you're going, having hamburgers outside, that hamburger is cooked. All right? Okay.